So we can start also with just introduction. So my name is Victoria Smith. I am a social worker at Vanderbilt Psychiatric Hospital. I work on the inpatient pediatric unit. So I work primarily with children and adolescents on the inpatient level of care. And then I'll let everybody else finish introducing themselves too.
I'm Kelly Gielan. I'm another social worker at Vanderbilt Psychiatric Hospital, the inpatient units. I kind of cover across all units, but primarily child and adolescent, and also Unit 1. And I'm the inpatient consult for behavioral analysis and intervention for the hospital.
Hi, my name is Susan O'Hara. We're having a little technical difficulty, so Ray and I are sharing a camera tonight, but I am a licensed clinical social worker. I work in the adolescent partial hospital program here at Vanderbilt. I've been at Vanderbilt for about 16 years, and I've been a therapist and a licensed social worker for almost 30. I've worked with children, teens, and families, and some adults as well. So looking forward to talking with you tonight.
And my name is Raeanne Maxwell, and I'm an inpatient social worker at Vanderbilt Psychiatric Hospital. I work on our co-occurring unit with adults, so I work primarily in substance use in adults.
And I think with Susan and Raeanne, whoever is speaking at the time, make sure you are the one closest to the mic that is in the computer. Okay. All right, ladies, take it away.
So today we're going to be talking about an overview of ADHD in the pediatric population, so children and adolescents. So to start off the conversation, we figured obviously it would make sense to talk about kind of diagnosis as well as what the assessment process looks like for ADHD. So the DSM-5, which is our manual for mental health, mental illnesses, defines ADHD as a persistent pattern of inattentive and hyperactivity / impulsivity that interferes with functioning of development or daily life. There's different subtypes of ADHD. The DSM-5 no longer really considers like ADD to be considered like a primary diagnosis. Now it's like the inattentive type, which would be the ADD. Then ADHD is the combination, and then you have like your hyperactivity. So your inattentive types, what those look like, I have the list here, but I'm not going to read through every single one because there's quite a few of them. And in order to actually get the diagnosis, you need to have 6 or more of the following for at least 6 months, and also in different settings. So it can't be like you're at home and you're presenting with just these 6 symptoms or more. It has to be in 2 different settings. So it'd be like home or school, for example. So one of the big ones is like for inattentive is failure to give close attention or details. You might see someone who's making like careless mistakes at school or other activities, maybe like overlooks like specific details that are prevalent to completing the task or activity. Again, that comes with like the difficulty with sustaining attention in tasks or like play activities. So it could be you're trying to talk with somebody and they just kind of seem like they're in la la land or daydreaming, not really engaged, easily distractible. Another one kind of going off of that one is does not seem like they're listening when people are speaking to them. Might seem like they're daydreaming again, or like they're absent in the conversation. Does not follow through with instructions, failure to finish schoolwork or chores, might start the task, but then becomes distracted, loses focus. So it might be like they're starting their homework or they're starting to do like the dishes if that's their chore, and then they kind of get distracted and they leave it midway through and it doesn't get finished. Difficulty with organization, they might avoid. So they often avoid, dislikes, or reluctant to engage in tasks that require like long-term attention or mental effort. So again, that's your schoolwork. Adolescents might not want to finish, like bigger projects. That could be like studying for your ACTs, SATs, things like that. They might lose things a lot, lose interest as well as one of them, lose like necessary things. That could be like if your kid comes home and they're like, oh, I have this project that I need to do, and you're asking them like, oh, okay, so like what do we need to do, and they list you 50,000 things and they don't have a single one of those things with them. That's one of the big symptoms there. Then when we move on to the hyperactivity and impulsivity, again, that requires at least six of the following for a period over 6 months. And again, a big thing too is to make sure it's, not a manifestation of a different diagnosis. So it's not related to a different cause, which we'll talk about later throughout the presentation as well. So some of those can be the kids or young adults or adolescents who you see that are fidgeting, tapping their hands, leg shaking, just really seem like they can't sit still. Often like leaves the seat even when they're, supposed to be sitting down or meant to do something, just because it's really straining for them to sit down. Need to kind of move around, have active movement. Could seem again like they're climbing on stuff, just that real strong inability to sit still. Excessive talking might be something you're witnessing. They might often blurt out something when they're not being talked to. For example, if like the teacher asks a question, a kid just might blurt out the answer, even though the expectation is like raise your hand if you have a question, if you have the answer. Difficulty with like waiting for their turn or patience. Might interrupt somebody or intrudes on others. So kind of maybe not really understanding that you need to wait till someone finishes before you start talking, or just kind of immersing themselves in conversations that might be happening around them. So those are the two different, so that's inattentive type and then hyperactive type. Combined type is a combination of both of them. So that would mean you meeting criteria for both of them. And over the 6 month period of time, again, in two different settings, that's a big thing. Sometimes what I'll see on the inpatient unit is parents will say like, oh, I think my kid definitely has ADHD. And I'll be like, can you explain like, what are you seeing? Because on the unit, they might actually be doing really well. Like they're sitting and engaging really well. They're not disruptive or displaying any of those symptoms. And they'll say, well, at home, they're constantly doing this, doing that. That causes me to then assess a little bit further, because if they're also doing well at home or they're doing really well at school, and then they're also in this setting not having issues with like regulation or hyperactivity or attention, that kind of makes me think it might not be ADHD. We might need to look at a different diagnosis. And then there's different severities. So you have like your mild, moderate, and severe. So again, here's overviewing some of those things that you might see in a child or an adolescent or, or early adult, young adulthood, that 18 to 19-year-old age. You might see some of these things. Something I think it's important to note is the gender differences. So oftentimes females go underdiagnosed with ADHD. Oftentimes males are primarily the ones who get diagnosed with ADHD. That has to do with the ways that I think differences in how genders show their ADHD symptoms. So girls tend to be more internalized. That might be like you're a daydreamer, or, that fixation on doing a task and then, just focusing on that, or waiting last minute to do it, but doing their best that they can at it. Boys are more those externalized symptoms. So that would be the more like climbing all over stuff, hyperactivity. They might be deemed as like the problem kid in the classroom, where the girl just might be the chatty Cathy of the classroom, but again, doesn't really warrant enough concern to want to pursue like further assessment of that. But that's something just important to keep in mind with ADHD, especially if you're working with like a female individual or child, is that they get, if you're worried about it, bring it up, because chances are is the school or, other settings they're in might not notice that you have these concerns, and it might get overlooked just because there's a lot of statistics that show that females do tend to become really underdiagnosed compared to males. These are some of the assessments that are used for diagnosing ADHD. The process for getting an assessment is, I'd say it's relatively simpler compared to some of the other diagnoses, is the process for getting a diagnosis in the assessment process. This can be done through like your pediatrician might be able to do that. Like at the psychiatric hospital, if they're inpatient for an assessment, that can happen there, as well as, social worker, mental health profession. Also going and talking to your school about it. The school might be able to complete that assessment through like, again, a school mental health professional or a school psychologist there. Something I tell families that's important to know for those assessments is like, we're going to look at these scales that we use as tools for assessment, but also it's important for us to know your background, like what's the family history look like. We want to know how they're behaving in different situations, not just in the one setting that we're seeing. So parent history reports are extremely important for us because oftentimes we might not be able to see the whole picture. So I recommend parents, taking a minute, writing down maybe the concerns or what they've been seeing behavior-wise, or getting reports from the school directly to bring to maybe a mental health intake appointment for their concerns that they have. Those are big things to consider. And then next, we're going to talk about what ADHD in the school setting specifically looks like.
So I'm going to kind of dive into ADHD in the school setting because on top of what I mentioned before, I have my school social worker certification. And it's where most of our pediatric population spends a lot of their time, right? They spend like 40 hours a week at school. So it's a really good place to provide the interventions that we know can be helpful for individuals with ADHD. And it's also an area that can have some pretty detrimental effects on self-esteem and like peer relationships if they aren't getting the support that they need in that setting. So a lot of the challenges that you'll begin to see in the school setting for individuals that have either undiagnosed or diagnosed ADHD are difficulties socially. So like Victoria mentioned, there might be a lot of interrupting or getting into people's space, doing things that are outside of the social norm that can cause other children to either not want to hang out with them, or they are too disruptive. They're not able to be on this sports team, or they can't be in this club, and it can become very isolating. So it can be difficult for them to kind of find a group of peers if they're struggling with being really disruptive in class or engaging socially, as well as with some of that impulsivity, possibly having altercations with classmates, like on the playground or in the halls. Additionally, you might start to see missing work or late assignments. The work crumpled up in the bottom of the backpack, and the locker filled with 7 jackets that they keep bringing in because it's cold, but they can't remember to bring back. Things like that. Permission slips. And again, you can kind of see how these all start to tie together. So if I forget to get my permission slip signed, now I can't go on this field trip with my class, that's going to feel pretty socially isolating. Me really like down on myself, beat myself up about it, and can have both the impact on the self-esteem and the peer involvement. Like Victoria mentioned, struggling with projects specifically, we know that time management is kind of a real sticking point for individuals with ADHD, both that it is difficult to orchestrate their time management skills, but also that if things are spread out over a very long period of time, it can be difficult to get the jump start, to start the project. If it's a 4-week-long project, to start it week by week, as opposed to the evening before. So those group projects, the longer projects, the research papers, things like that can be really difficult. And then finally, the disciplinary actions that can come down from the schools. So schools that have zero tolerance policies, schools that have like a certain amount of strikes and then you're out system, it can really become difficult to continue to have children in those classes because of the policies that are written. So even if the school is like motivated to get the interventions, if it's like 3 times of fighting and then you're out, and that's what's written into the school handbook, you're in a real tricky spot if that happens. And so we'll see a lot of times individuals with ADHD, all of the different subtypes, start to spend a lot of time out of class, which we know is not beneficial for either the social or the academic component, but they're being either sent out or held out due to some of the symptoms that come with ADHD. So these are some of the ways that you can get the support in the school setting if you need something more than what the general education population is providing. So IEPs, which are individualized education plans, and 504 accommodations. These both exist in the public school system. So a private school, parochial school, they do not have to honor these. They can. So if you go from a public school where you have an IEP to perhaps like a private high school, you can bring it to them and they may honor the services that you were getting at your former school. But the actual legal process and obligation to a free and appropriate public education only applies in the public school system. So kind of jumping into that, IEPs, or the individualized education plans, are the documents that are protected under the IDEA Act, which is the Individuals with Disabilities in Education Act. These, I always tell families when I'm talking to them, the big difference between IEP and 504 is the IEP is the legal document. So this is the one that is covered under law, special education law, that offers you certain protections as a student. That being that you have the right to a free and appropriate education in the least restrictive environment. So there are 14 diagnoses that fall under an IEP, and ADHD is not one of them. It is not one that is explicitly stated. The question I always get asked is why? I wish I had a great answer. There is no great answer other than people that were putting together some legislation somewhere thought that it was not one that needed to be included. So what we do see is a lot of people can get them under there's a category called other health impairment, which has become kind of the catchment area for individuals with ADHD. The other one is either emotional impairment or emotional disturbance, which can be used for some of those behavior dysregulation symptoms that sometimes you can get an IEP that way as well. But it is different from like autism or something that has its own category. What you might see the school say is the student is getting C's, they're passing, like they're getting their free and appropriate education. But if you can kind of advocate and make the argument that, well, this isn't in the least restrictive environment because my child could be getting A's, like they have ADHD and there are these impairments, but they could be exceeding higher than they are, but they're limited because they're not getting the services they need. That's kind of the argument you have to make for the IEP. The upside to the IEP, like I said, is it is a legal document, so it requires certain protections. I think one of the ones that I find most beneficial for individuals with ADHD is there are things called manifestation determination meetings that have to occur. So if you have a child, particularly when we think like our young kids with hyperactivity that are struggling with the impulse control, that sometimes the schools with zero tolerance policies or strike systems, they start to get in a lot of trouble. And the school says, okay, well, now they need to be suspended for 2 days, or they've been suspended 3 times, so now they need to be expelled. A manifestation determination meeting blockades that. The intervention team and the parents have to get together and discuss, is what this child is looking at being suspended or expelled for a manifestation of the diagnoses that their IEP is supposed to be addressing? And if the answer is yes, they cannot be expelled. So if an individual continues to like kind of get up and be really physically hyperactive during class and the teacher keeps kicking them out of class to the point of suspension, possibly expulsion, they have to have this manifestation meeting. If the argument can be made that this hyperactivity is a symptom of their ADHD. They're not getting enough services. Let's look at getting them like OT or movement breaks or better like fidget or flexible seating tools in the classroom. Those are what will be put in place. The IEP will be adjusted and the student cannot be expelled. That being said, sometimes in manifestation meetings, they will rule that it's not a manifestation of the diagnoses that the IEP is for, and then that protection is kind of null and void, and it's treated like a regular disciplinary action per the school's policy and handbook of the district. The other upside to an IEP is it gets reviewed annually, and there is typically, depending on the school district, a reevaluation every 3 years. So you'll get some updated academic testing. 504 accommodations are what you will see individuals with ADHD have a lot, because since it's not explicitly stated under the IEP, a lot of times schools will try first to have those students have a 504. And it can be for a plethora of things. So students with anxiety or students that have some other type of diagnoses that needs some extra intervention, but might not affect in a like very narrow sense way academic learning, like a learning disability. You'll see them fall into the 504 accommodation catchment area. This is where you'll see things like movement breaks, extended time on tests, testing in the other room. Those are the types of services that you'll get through 504 accommodation. The upside to 504 is, while it's not a legal document like an IEP, it does follow the student through school. So as long as they stay in the public school system, the 504 is supposed to be transferred from teacher to teacher as they move up through the grades. It does not have the disciplinary protections that an IEP does, but it can be modified. So if you are seeing this isn't enough support, I want to call like a meeting with the intervention team. Let's add some more services on some other things that we've seen be helpful throughout the school year. These are just some examples of things that often come up. One thing that I always tell parents to keep in mind is every IEP that is completed is costing the school money, right? So all of those services that are in the IEP that are now the school is legally bound to provide are coming from somewhere, right? They might be having to pay for psychologist, social worker, behavioral analysis, something like that. And so there's a reason that IEPs are difficult to get, and why they don't just give every child in the school individualized education plan, although that would be lovely. So we kind of touched on the first one, which is the one that I would see the most in the public school system, particularly with ADHD, is the school would come back to the family and say, well, your child isn't failing, like your child has not been retained, they're at grade level, is always kind of the best and worst thing that you hear, which means like they are passing with C's, which can be quite distressing when you know your child can do better, but is suffering with their ADHD symptoms. Additionally, like my child's doctor said he needs an IEP, that's great, and it can definitely be a letter of recommendation, but that doesn't bind the school to doing an IEP. It has to be done through their own testing and their own IEP process. The school says my child already has an IEP and does not need a reevaluation. You can request for a reevaluation and a new intervention meeting anytime you want. And if there is something you disagree with and you happen to get testing somewhere else, or like Victoria was saying, if you happen to get diagnosed when you're inpatient at the hospital, you can bring that testing to the school and request a meeting, and they have to have it. My child has an IEP, but the school wants to remove it. So kind of the flip side of it being helpful that IEPs are reviewed annually, or there's meetings annually, is that means they're also looking annually at, do you still need this? Or can we bump you down essentially to a 504? That's One of the things that you'll see happen a lot with the emotional impairment or other health impairment categories, as opposed to like a intellectual disability, something that it's harder to make an argument of this no longer is there. And so I always tell families, the school a lot of times will come in and be like, your child is doing so well. They don't need all these services anymore. They're doing so great that all they need is a 504. And I always tell families, don't do that. Like if you got the IEP, you have the legal protections, keep it, especially because when you look forward to, okay, my child is graduating, IEPs require a transitional meeting. So if your child is graduating at the age of 18 or in some states at the age of 22 out of special education, there has to be a transitional meeting with the special education team and the intervention team at the school to figure out next steps and what can be most helpful. And it's also helpful if you have an IEP, that's something you can bring to the college if you are transitioning to college as well for those accommodations. So how to get started? The first thing that you have to do is request a full evaluation. Under IDEA Act that I touched on earlier, there's a legal requirement where if testing is requested in writing to a public school, it has to be honored or begin to be honored within 60 days. But the key part of that is it has to be in writing. So this looks like writing a letter to typically either the special education coordinator or the head of the intervention team or school psychologist that I, Kelly Gillen, am requesting that my child have a full academic and psychological evaluation to be reviewed for eligibility for an individualized education plan. You'll get a letter back in the mail typically that says, okay, we'll get on this in 60 days. And most of the time by April of any academic school year, if the school district is like medium to large, you're looking at testing probably falling in the next academic year. Because if you're thinking you request in April, they have 60 days, but the summer doesn't count. So I always tell families to kind of hop on it as early as you can. Like there are some families I've worked with the first day of school, they're in there bugging the special education coordinator, and that is wonderful. So after the testing is completed, there will be a team meeting. Typically, you'll go into a room, there will be a psychologist, social worker, your student's teacher, and possibly like an occupational therapist, speech therapist, depending on who that school has on staff. And they'll kind of all sit around, review the assessments that have been completed, their findings, and do we think that this child qualifies for an IEP? And they will essentially kind of discuss and vote on if this meets the qualifications needed. If it does, then they will work on conducting an IEP, what types of services could be helpful. And then you will get a draft of the IEP as the legal guardian. That IEP will not go into effect until it's signed by the legal guardian and returned. So if you get the draft of the IEP and you're like, I don't agree with this, or they need counseling much more than once a week, or I want them in this social skills group, you don't have to sign the draft. You can ask for another meeting and you can continue to discuss and advocate on their behalf. And like I mentioned earlier, you can also bring in additional testing that was completed outpatient, and they have to review that as well. Some interventions that can be helpful for the school setting. These can be implemented either through an IEP or a 504, so they can fall under either. Visual schedules, so having it posted up, like what are we doing when, what's coming next. Choice cards, so having some visual aids with 2 to 4 choices of things to do when we're feeling a little overwhelmed or dysregulated. Any type of reward system or token economy that can be great. Those are a little bit trickier to implement in a large class setting, but if they have an IEP where they have some one-on-one assistance, those can be really good. Some movement breaks, specifically heavy work. A lot of times movement breaks for kids looks like they let them take a lap up and down the hall, which we know isn't especially helpful, but if they can go be like a special helper for the social worker, like unpacking food boxes that are going to go home with people, something that is active in a way that is using their muscles as opposed to just kind of strolling around the school, can be really beneficial. Any type of special helper jobs can be great because we know that children in general really do well with that specific labeled praise. The flexible seating, like I mentioned before, and then some fidget aids. I know that's a touchy subject with most teachers. The fidget spinners I know have been banned most places. One that I really like that I think teachers are able to get on board with because it's not in the eye line of the other students is taking one of those TheraBands and having it tied around the bottom of the student's chair so that they can kind of kick it with their foot back and forth and use their muscles throughout the day with that. Can be really beneficial. And it kind of doesn't have the noise and the other kids aren't really looking at it as much. So I find teachers a little more amenable to that intervention.
Hi there, my name is Susan. And as I told you guys earlier, I am a clinician with a lot of experience, but I am also a parent. And 2 out of 3 of my children have an ADHD diagnosis. So I have heard a lot of jokes that end with the punchline, "Look, squirrel." And I've also had a lot of unwanted and unhelpful advice. Maybe some of you guys have as well. We love our kids and we wouldn't change anything about them most of the time, but sometimes parenting is hard, and parenting with children who have an ADHD diagnosis can be especially hard. It's exhausting. It can feel defeating at times. And we see their amazing gifts and the things that make them unique and special. And that's part of what our job is to help them balance some of the negative feedback that they get. And the feedback can come from peers, from friends, parents, from teachers, even doctors. And it's so hard to see this person that you love so much feel and absorb these negative messages. And we have to balance that and find ways to focus on their strengths and focus on the things that they can do. I wonder if any of you guys, when I was working on this, I thought I was trying to think of the funniest ADHD moments throughout the lives of my children. And I wonder how many of you guys have found perfectly finished homework that was due last week, never turned in. Maybe it's on the kitchen counter or under their bed or crushed in their backpack. How many people have been given organizers by people who want to be really helpful, usually people who are organized themselves, and they have got the perfect thing that's going to help your kid. Oh, they just have to try this organizer. And how often is that organizer left right on the table? Or maybe the organizer makes it into the backpack, but the backpack gets lost. It's like Kelly was saying, or it's at the bottom of their locker. The other thing that comes to mind that happens a lot are the projects that they're super enthused about. They can't wait. Yes, Mom, get me that paint set or get me a piano. No, I'm going to do it this time. I'm going to do it. And they do it for a couple days or a couple weeks. And where are they? Well, once it gets really boring or hard, or they have to have that sustained attention, they're on to the next thing that is exciting and interesting. And we're left with the bills of all these things. And sometimes they even pick things that we're excited about, like, oh, okay, they're going to get organized. They want a bullet journal. Maybe they're all into Post-it notes and color coordinating everything. But then they lose it, or they lose interest. And you might find 5 bullet journals with 2 pages of entry in each one. And these are the lighter moments. There is the heartbreak of seeing your child shunned by kids and friends. They might get invited over to somebody's house once, and you're left wondering, okay, did they blurt something out? Did they interrupt? Were they too loud? Did they break something? And they're sitting here with all of this wonderful personality and lots of great skills, but they have deficits due to having ADHD, and they often lag behind developmentally. And this is really hard and frustrating and heartbreaking. And sometimes we're afraid about the impulsivity. Are they going to do kooky things without thinking? So I want you to think for a moment. We're going to talk today about some of the challenges, and every family has a unique set of challenges. I am also want to say that they're going to be okay. Most likely, we're doing the best we can. A lot of what I'm here to say is that you have to give yourself a break. You've got to find ways to simplify your life and take care of yourself as you're managing all of this stress. Going to IEP meetings every year and fighting and advocating for your rights. So I have a friend who is an adult with ADHD, and she has found a compensation. She's got a doctorate, super smart and polished and all this. She could focus and do those things, but she cannot remember her keys. And she has a set of keys under planters and under pots and under rocks in her yard. So this is not necessarily something that's going to get better exactly, but it can get different, and it doesn't mean that people with ADHD can't have wonderful, happy, successful lives. And part of our job as people who love them, whether we're parent or teacher or therapist or guide, is to really help them see the strengths and see the things that they're doing right, and look at ways that they have improved. Sometimes they lose their sense of success and the distance they've come. So you might help them figure out their compensations and their workarounds. Let's think for a minute. We could go to the next slide if you want. Take a moment, and this is something I not only encourage you to do for yourself, but I think it's a great practice to bring into the life of your child and family, is to find tiny little moments and tiny ways to slow down and take a breath and take in what you're feeling and what's happening. So I do want you to do that for a moment and just think for a minute, what are the hardest parts of having a child with ADHD? What we spend a lot of time talking about what the children need, and that's really important, but it's also important to support you as their caregiver. It's about self-regulating, because sometimes their behavior can really make us feel upset and frustrated, and we can mirror some of their feelings, feeling defeated and sad. So for those of you who had a dream picture of a family, and I'm thinking of like the idea of a family sitting around a table and the dinner's there and you're sharing this warm experience and you're having conversation. And if you got an ADHD child, that may not be the picture that you have. If you are like our family, one of the kids might be under the table, lying on his back with a ball on his feet, and he's talking and telling you about the food that he might like, but he's juggling that ball with his feet. Another child did not hear you the 15 times you called them. They are hyper-focused in a graphic novel. And if you have ADHD, and studies say that somewhere between, if your child has an ADHD diagnosis, it is 40 to 50% likely that one of the parents also has an ADHD diagnosis. Your dinner might not even be on the table. You may have burned it, or it is half done, or you forgot some of the ingredients. And we talk about this in ways oftentimes like, well, that's just how life is. And it is how life is, whether you have a kid with ADHD or not. But there is a kind of loss and a grief to having a different kind of family. You may have friends or family members who have a family that can sit at the table and have conversation. And sometimes it hurts that they're having this family life that may feel unavailable to you. For some of you guys, the hardest part might be dealing with the criticism and the judgment and blame that can come from all places. It can come from your pediatrician. They might look at you like you're not doing a very good job with discipline, or you're not giving the stickers correctly. It could come from friends and peers. It can sometimes come from spouses. When you have a kid who has ADHD, sometimes parents look at each other and think, well, that's because you did this. Or the other person turns to the spouse and says, well, no, it's because you did that. And we can internalize this and start to feel like we're bad parents or we're failures. We didn't do something right. And these are the same feelings that the kids can have. What's wrong with me? Why am I not able to do what they're asking me? And this is when sitting and taking a deep breath and thinking about what you need. You may need to just have a friend say, you are a good parent. You're good enough. And some of the ways to help manage stress are to tell yourself, you know what can I simplify? What can I cut out? If your child takes 30 minutes to find their clothes, or they were putting on their pants, but then they got interested in the book on fairies, and they could come down and tell you everything about fairies, but they're not dressed, you might let that child sleep in their clothes. And you are allowed to do that. Part of your work is letting go of perfection, letting go of your expectation, and moving towards self-acceptance, being right where you are, allowing yourself to be good enough. Some people will feel most challenged by all the conflicts that come up with either with your child or with other people. Your child may lag developmentally on skills that other kids have. And they are not being naughty or bad. They just don't have the capacity. And it may take, one of the things that's really difficult is the kids with ADHD often do not learn from their mistakes the same way other kids do. And it is so frustrating. And sometimes even when you know it's the ADHD, it's hard to believe that they're not doing it on purpose. And you may hear people like with the judgmental people who are saying, in my day, we just called the kids lazy, or you need more discipline, things like that. And this can create conflict with you and the other people, but it can also make you think, what's wrong with my child? Or As they move into teen years, it's even more stressful because the conflicts are in direct, their developmental tasks to be independent and be on their own and do things by themselves don't work, because you may have to help your child more. You may have to supervise them more than other people with the same age child. And you think about, they want to drive and they want to go places. And it's all reasonable to want to do those things, but you may have to parent them in a way that says, well, you got to take your medicine if you're going to drive. And they might be in a place where they've decided to take ownership of medicine, and they're like, well, I don't think I need it. This is when you get to your support team and your community, and you talk to the doctor, and you maybe try a trial of medicine, going off medicine. But these are all the reasons you need to have your people. Find your people who understand you, who know what it's like to have a child that doesn't quite fit. I've had people tell me, you know what, have you ever thought about doing timeouts? And you're like, oh my goodness, timeouts. We've tried that. We've tried everything. So you are going to have to be flexible and come up with creative ways to manage this. No one thing, no one intervention is going to work all the time or for everyone. I do encourage you to find support groups for people with ADHD, or read books. At the end of the presentation, there's some really good books and some organizations. You are not alone, but sometimes you feel alone if the people in your circle don't have a kid that's wired in this similar way. A lot of us have fears for our children, even just fears that they aren't going to get to fully be themselves and be the person you see that they can be. And sometimes we have very real fears of unintentional injuries because they're not paying attention or they're being impulsive. We have fears about substance use or unprotected sex, all of those kinds of things. Or the fear that they're trying to take on some responsibility, and they're like, I got it, Mom, I'm sending in my college application, and they forget. So these fears are all reasonable, but also talking it out with the people who can support you and your needs. I really recommend some fun times and relationship building. You can go to the next slide if you can. Yeah, the relationship you have will be the most sustaining thing. It will allow you to have as much influence as you want to have in terms of helping them stop and think. Creating rituals, like one of the things I do with the kids that I work with, but also with my own kids, is have them come up with some kind of savoring ritual. As a practice. Like it can be drinking their juice or drinking their water or a hot tea or hot chocolate, or it could be petting the cat or sitting with their dog. Something that they choose that they like, and it's a way of slowing down and just sitting for a moment with this feeling and using all of their senses to enjoy it. And this kind of little mini mindfulness practice starts to build some self-control. And then you start to work on having the child be able to take pauses. You can do games that actively try to stretch that waiting muscle. Like we would play red light, green light, but in slow motion. So they would have to kind of try to stop themselves. And then you just build it into life, like sort of say, let's take a quiet moment, or let's sit here. And I know you're thinking, not my kid, they aren't going to do that. And they might not, we talk about the monkey brain, like when we're doing meditation where your brain's going all over the place. And that's one of the great things about ADHD is your mind goes all over the place. And it's okay. You're just building this practice and this kind of conversation about getting your brain to do what you want it to do. But I tell you these things too, because it's really good for you. If they can't do it, if you just have that quiet moment where you're just taking a deep breath and sitting with yourself and saying, I'm a good enough mom, I'm a good enough dad, I'm a good enough parent. And then you're like, I'm going to call my friend and we are going to talk about this later. But reaching out to your community and finding your people that are going to tell you, you are doing a great job, you're doing good enough. It doesn't have to be perfect. Yeah, so there's a lot more we could talk about, but I really want you to hear from Ray. So.
Right. So I won't rehash the impact across different areas of our lives, but one I really wanted to touch on was the impact on our behaviors, the perceived defiance. I put perceived because I think it's important to remember that children or adolescents who are diagnosed with ADHD aren't refusing to complete a task that's hard because they don't want to or because they're trying to give you a hard time. It's usually due to feeling overwhelmed. They're distracted, they're unsure of what's even being asked. They may struggle with focus while being asked to sit still or stop being disruptive. In some cases, these kids truly do not have the capacity to control some of these behaviors. And so, like I said, I won't go through all of the different impacts. I think Victoria and Kelly and Susan did a wonderful job explaining that. So just to recap, this is how it impacts us, and we can move on to comorbidities. So first, I'll briefly define what a comorbidity is. It is a disease or medical condition that is simultaneously present with another or others, usually independent of another condition. One doesn't necessarily cause the other, but if not assessed properly, it can complicate treatment. So think of them as being partners with each other. So substance use disorders are common in people who are diagnosed with ADHD. Patients with ADHD tend to experience substance use disorders earlier, become addicted more easily, have lower remission rates, are hospitalized more often compared to people with ADHD, people without ADHD who do not have a substance disorder. This is likely due to self-medication to manage their symptoms or the impulsivity of ADHD diagnosis. Some families have voiced concern about medicating their children because they don't want the child to develop a physical dependency on the medication. But appropriate management of ADHD symptoms, in theory, it could prevent the risk of addiction. We also see depression in people who are diagnosed with ADHD due to the many obstacles that they face. So disappointments, perceived failures, the lack of support and understanding that is required with this type of diagnosis. So remember, the child or adolescent is not intentionally being defiant. They're not trying to be lazy. They just have a disorder which makes things that are simple for other people very difficult for them. And that can lead to a lot of, like Kelly said, self-esteem issues. We can also look at anxiety. When we're talking about anxiety as a comorbidity with ADHD, we're looking at social anxiety and generalized anxiety disorders. So imagine a child or adolescent in school, they constantly get in trouble for talking to their neighbor or interrupting the teacher. They start to self-monitor more often to prevent from getting in trouble, which can lead to the child shutting down, which could lead to developing a social anxiety disorder. Now, moving back to generalized anxiety disorder, people with ADHD often struggle with executive functions, which are basically just a group of skills we rely on to get our tasks done, such as organization, planning, managing time. These skills also helped us with adaptable thinking, self-control, memory, organization, etc. They can also help us manage our emotions. So struggling with these skills daily will inevitably lead to stress, and chronic stress leads to anxiety. Personality disorders, specifically borderline personality disorders, is seen with ADHD quite often. So think about the impulsivity, emotional dysregulation, and interpersonal problems, thinking back to how it impacts us socially. So a lot of the comorbid disorders that we see with ADHD also have overlapping symptoms, which can make it really difficult to differentiate the diagnosis. So with ADHD and anxiety, we see a lot of difficulty concentrating, difficulty focusing, restlessness, some distraction. Same thing with ADHD and depression, a lot of the same symptoms, difficulty concentrating and focusing, in addition to mood swings and sleep disruptions. ADHD and borderline personality disorder overlap in that they are both present as impulsive, difficulty regulating our emotions, and even some interpersonal issues with family and friends. But there are some differentiating factors that we are going to look at as well. So when we're looking at ADHD versus anxiety, we really need to look at the reason for the inattentiveness. So in anxiety, inattentiveness is due to worry and rumination. So you might hear a child with anxiety asking a lot of what if questions, a lot of worry and concern, versus in ADHD, it's typically due to an attraction to an external stimuli or something more enjoyable. So when we look at ADHD versus depression, symptoms of depression are usually prominent during a depressive episode, whereas symptoms of ADHD are going to be more consistent and chronic over a 6-month period. And then also looking at ADHD versus borderline personality disorder, we really want to look at the fact that ADHD is not characterized by the fear of abandonment, self-injury, or extreme ambivalence. This could take an extended clinical observation or collateral by family to make this distinction. Now, while these can absolutely exist together, they can also not happen at the same time. So that's important to remember as well. And going into our next slide, why is it important for an accurate diagnosis? So treatment looks different across the board for different disorders. For example, borderline personality disorder, there are no medications. We're looking at dialectical behavioral therapy. Even ADHD can be treated without medication. Stimulants, they aren't for everybody. It's also important to get an accurate diagnosis because if left untreated, like my colleagues just mentioned, there are a lot of ways that ADHD can impact our child or adolescent negatively. There's also different treatments for support at home, like Susan just talked about, and even school accommodations, like Kelly mentioned. So we've thrown a lot of information at you guys, and a lot of it isn't super positive. So I wanted to end the presentation on a strengths-based approach. So people with ADHD often live very successful lives. In doing my research for this presentation, I read that people with ADHD work really well in high crisis jobs. So think about like firefighters, nurses, police officers, things like that. They also tend to have high energy and are creative. So they tend to have a different perspective on life and approach tasks and situations with a thoughtful eye. They tend to be inventive thinkers. Other words that have been used to describe people with this diagnosis are original, artistic, creative. They are also hyper-focused, which can be an advantage. It gives them the ability to complete tasks without breaking concentration, which is very helpful in a college setting or even in the real world when they move on to their careers. So as we wrap up the presentation, I just want everyone that's listening or watching right now to think about some of the strengths your own child or adolescent has. And feel free to write it in the comment box if you want to, or keep that personal and take it home to your family and praise your child or adolescent strengths.
I also want to add, I think it's important too when we think about like neurodiversity and ending the stigma around I think sometimes there's a lot of negative stigma around people who are neurodiverse or, like autism. That's another neurodiversity that people sometimes have like stigmas about or stereotypes about that, ADHD, it doesn't mean like you can't amount to anything. It might be a little bit more difficult, certain tasks. You might just need some fidget toys and some redirection and reminders, but you're still capable of doing anything you put your mind to it. I often tell kids on the inpatient level that because they express a lot of frustration of like, why can't my brain just work? Like, why can't I just be normal? Like, I just want to be a normal kid. I don't want to get in trouble all the time. Like, why is my brain broken? I hear a lot. And I always reference them. I say, your brain's not broken. Your brain is just your brain and it's super unique, and that's not a weakness, it's your superpower. You know, I think of, you are so creative, you think of all these ideas that I, like, other people's brains might not even have like the ability to go to. And, you know, just because you take a different path to get there doesn't mean your path is the wrong path. And so I think that's important to always remind people, and any mental illness as well, as that, you know, it doesn't make you broken, it doesn't make you damaged. Our brains are different, our bodies are different, we just have to do things a little bit differently, but that doesn't always have to be identified as weakness.
Thank you, Victoria, and thank you all of you for all the information that you brought forth tonight. It really is very much appreciated, and I think ending on just the note that you shared, Victoria, that people's minds work differently. That doesn't mean they're defective. There's nothing wrong with them. They're just different. And I think helping your child to learn their path. And having the patience to live with them. I had one of my kids, my middle child, had ADHD traits, definitely, and did have an IEP. And I kept thinking to myself, he was extremely stubborn, but that stubbornness, if he found something he liked, he'd go after it. And I kept thinking, if I can just channel this, if I can survive it and channel it. And so it's finding that, it's pulling the jewel. I will share that myself, I'm self-diagnosed ADHD, and all the strength-based things that you just talked about, and my staff can let you know that sometimes I do bounce around. But it also gives me an energy that most people don't have, and the creativity to see things and problem solve in ways that others that don't. And so it's trying to find the gifts, within. So I'd like to see if there's anybody out there that has any questions for any of our panelists tonight. It would be great if we could take down the stop sharing so we can see folks, and ask people if they have any specific questions or comments that they'd like to share. I thought it was an excellent presentation, guys. Really, thank you so much for that. I see Rhonda's got her hand up. What would you like to share?
I'm clapping for them, Rhonda.
Oh, thank you. Thank you. I forgot that was sideways and up straight is the hand. Yes,
Yep.
Thank you for that. And then thank you, Dorothy. We appreciate you too. I just noticed that Leslie became unmuted and wondered if you had any comments that you'd like to share.
Oh, I have a comment and a question. First of all, I think this presentation was fantastic and really helpful. So I appreciate you guys all sharing your time. And as a nurse and as a mother of a child with ADHD, I found this enlightening. I really appreciated a lot of what you said about how often people say, oh, if you just use this planner or you use this path, that's what's going to work. I find sometimes, though, as a parent, that when I send my child to school, I'm sending them into this void. And then she comes home and maybe has a hard time expressing some of the things that she's experienced. Or are there any tips or tricks that you have for parents who are sending their child out to help them find their special way to be organized and remember some of those things that they struggle with, or that overwhelmed feeling that they have with those really big projects? Is there anything that you found, not that one thing works with everybody, but any tips or tricks that you would have?
I actually have a personal example from my mom, because she got really tired of me coming home and she's like, what's your homework? And I was like, oh, I don't know. Can't remember that task, Mom. And she's like, you literally have this planner. All you got to do is write in it. And she's like, all you're doing though is doodling. And I was like, yeah, I don't know. I forgot that point. So she because with my IEP, she asked my teachers if like they could let her know like assignments or upcoming projects, because this way then she could like help remember me. And then it also annoyed me a lot because I don't like to be nagged. And so in turn, my brain was like, please stop asking me about this assignment. Like, I know. And she's like, okay, well, so then it just kind of helped me to remember. But I've also seen now, I have a friend who's a teacher, and she teaches elementary, and she has these like little like paper watch band things that are really cool that she like puts on some of the kids' wrists, and it actually has like a little note on there. And so when they go home, they have this like little watch, and the mom and dad are like, oh, okay, cool. And the kids, they don't feel like, it doesn't feel like they're being like labeled or, you know, like the scarlet letter, things like that. It's kind of cool because it's like, I have this cool watch, like I feel special. And it's just like a little note that lets parents know like what you have. I also tell parents too when they're meeting in like an IEP meeting to talk about like communication ways, things like that that can be included. I don't know if Kelly, if you have more kind of tidbits on that either.
Yeah, I was gonna say also like personal story wise, but things that I also saw helpful when I was working in the school system is the antecedent interventions. So like whatever book they're reading in class, like my mom would also buy that book at home so that then when I go home and realize I don't have it, as opposed to that like sinking stomach feeling, like beating myself up for why can't my brain work, like, oh, we have the book, like there's a solution. So just kind of like embracing the neurodivergence. So yeah, like duplicate everything. So like there is Tylenol in my pantry and my work bag and my desk. Like there's just, because I can't remember it. And so kind of just finding ways to embrace that as like, okay, this is how my brain works. So let's find a solution that works for me in a way that kind of takes that shame and guilt that Susan touched on away. Because the school is set up for the one track, right? Like it teaches to the general population, it's set up for the general population. So you kind of have to be a little creative in what can we do here. Like I've had kids have 2 backpacks, like one lives at school and one lives at home. Like we're just gonna have multiples.
And I think, Kelly, I think part of what we're talking about here is meeting people where they are.
Mm-hmm.
You know, and that's a part of it. Recognizing the strengths that they do have. And I know you guys have some books to share, but I found one of the best books is a classic, which is, you know, Driven by Distraction. And and I love, for anybody with ADHD, if you're a parent or it's the child, you don't have to read the whole book cover to cover. I love that the person that wrote it went, you know, you can just pick out chapters because that's what those of us with this stuff do. And then, you know, the tips that were in the back were helpful. And the other thing is just quit going against the stream with whoever, you know, with this kid. One of my middle kid, by the time he got to middle school, he was failing his classes because he was bright enough to know the information, and he hated doing homework. He hated having to concentrate on homework. He would take a test and ace it, but with a 0 homework grade, he had a 50. And so, you know, we worked. Yeah, no, he had responsibilities just like the others. One of the things was saying that it wasn't so much the grade, is I want you to learn this is part of the world, and I need you to understand that sometimes you do have to go with the way things are set up. I know you're smart enough. I get that. Yes, you are. And, you know, no doubt about it. But some things we would do, we did what Victoria, we absolutely did what Victoria had done, which was, yes, we will contact the teacher every day for a week. He had to go to every class and every time, you know, and I love the wristband idea, by the way. But yeah, some of this is meeting people where they're at and understanding that they're, you know, your brain, okay, so you don't fit this box over here, but dang, over here, you've really got something going. So let somebody else work on that skill if you can do it. You know, let's do that. So we talk a lot about meeting people where they are, and I think this is a big part of what we're doing here.
I think the most empowering thing that like I've ever seen happen to me or also witness other people is actually giving the power to that person and asking them, what do you think is going to be helpful? Like, what ideas do you have? Like, how can I help you remember these tasks or succeed in these things, and giving that kind of control of like, you are a part of this. I'm not here to control you or feel like I'm changing you, but let's use that creative brain that you have such strong strengths in, and kind of asking them what ideas work for them, and holding a space if they're like, no, that's not going to work. I'm like, okay, well then let's try the next thing. Because oftentimes I think control feels really lost, especially with mental health, especially with ADHD, because you often don't feel in control at times. So to have a moment that just forces you to kind of sit there and actually think, and then you're like, oh wait, okay, like this is going to help me, is really powerful.
I have an idea as well that links to what you're saying, Victoria, and it's to link unwanted, like things that are not as interesting or things that they're not wanting to do as much, to things that they do like to do. Like, so in habit formation, like the linking, remembering to bring your homework with like getting a treat, or just like, connecting it to a song. Like that was one of the things, like linking memory to like singing, like before, like you would leave, like to get your backpack, your lunch or whatever, and making it into, it could be a goofy song, or it could be like some song that they love, and that you're like playing it while they're getting their stuff together, and then they start to line the stuff that they have to remember. But another thing I think is helpful parenting wise, that I work with, whether people have ADHD or not, is I think it's really helpful for people to be transparent about their own process. That a lot of times we think kids, like stuff might come naturally to us, or maybe we don't even remember how we learned to do stuff. And so it might feel really mysterious to them. But if you can say, like whether you're like, this is how I help myself calm down, or, and not necessarily in a teaching way, but just, I even have parents like in the car, oh, I am so frustrated and mad at the traffic. Because a lot of times kids don't realize, like, their parents get mad in little ways all the time, and they have to like work through it. And so it's an invisible process that they don't see. Well, remembering is the same way, or even finding out what you like. That was part of what I heard, is like, she maybe hasn't found her place, or she hasn't quite figured out. So you can just be like, gosh, I can't figure out what I want to do. I can't figure out what I want to have more friends in my life. And these are the ways I'm thinking about it. In a way that feels authentic, like not super, shoving it down their throats, but you know what I mean? But just helpful, like helping them understand how you remember to remember, or how you find your way.
And I think to add to what Susan is saying, it's also really important to let them have those negative emotions without making them feel bad about it, or making them feel like, okay, I'm upset, I'm crying, I'm frustrated, I need to dry it up and fix it quickly. Like let them experience those negative emotions and show them, like Susan is saying, how to process them in a healthy manner.
And thank you guys. I think that's all great. And I think one of the things I was just thinking of is a lot of times we said, a great percentage of parents with children that have this these identified issues also have them themselves. And what we have seen at NAMI Davidson is there is a class called, and Rachel, thank you. I see a hand up in the chat, and we'll make sure we get to you. But we often see, parents, we have a class called NAMI Basics for parents with kids between the ages of 3 and 17. And I remember very, very specifically that there was a gentleman that came into the class because he was very, very frustrated with his 10-year-old. He was incredibly frustrated with this 10-year-old. And as he went through the class, he identified with what was being said. We educate in that class, and then he realized that he himself had it, and that he gained tremendous empathy for his child, and then they ended up going in and getting help together. And that was really beneficial to the child. Rachel, we've got a few minutes, just a couple of minutes here, but I want to make sure you get your comments or questions in.
Thank you so much. I'll try and make it quick. I really appreciate the contributions every one of you has made. Your research and your insight is very valuable. And this is the first of these types of things that my wife and I have joined, and we appreciate you. So my question is this: our son currently has an IEP for giftedness in Tennessee. He also tested high on the ADHD scale. Is there a way or a person that is exceptional at being able to put that into the right context? In other words, to tell the difference between, is he gifted and is he twice exceptional or gifted?
Ladies, would anybody like to respond to that?
That happens a lot. Like sometimes people, and obviously not you guys, but some people think if you have ADHD, it has an impact on your intelligence or your IQ. And very often we see that combination of gifted and having ADHD or a different learning disability of some kind. But so I can't speak specifically to your child, but I mean there's the overlap where you might have like super focus on things that are really interesting and have no interest in things that seem boring or meaningless. So that kind of can look like that can be in a gifted child and a kid with ADHD. But so I don't know if Kelly or somebody wants to make a comment, but that's something that happens very often, that you have both.
Thank you.
Yeah, and what can happen a lot with individuals with ADHD, since we know it doesn't impact their intelligence, but it can impact their ability to take assessments. If the school is administering like the WISC, their IQ could be skewed, not because it's lower, but because the WISC is a long assessment and it can take a while and a lot of focus to complete. So it can be skewed that way. There are different things I've seen families do. Some will do a full psychological and academic evaluation unmedicated, and then a full psychological and academic evaluation while medicated to see if there's a difference, to kind of control for, okay, while they did the IQ assessment, was this an attention impairment or is this an accurate representation of their intellect? And then I've also seen, I know Susan touched on like habit training. A lot of times individuals that are gifted and have the overlap with ADHD really love to pour themselves into what they hyper focus on. And it's really difficult to not apply it to the things that are uninteresting, or especially that boredom then can be compounded in the school setting because they already know it. And so they're bored for two reasons, which can lead to acting out behavior sometimes, particularly in the gifted population. And so doing some habit training of, okay, we can, like if they really perseverate on like different types of aquatic animals, we can work on that after we do 2 sheets of whatever the non-preferred activity is, to kind of channel the motivation to kind of help it be more generalized, if that makes sense.
Thank you. Thank you so much, Kelly.
Yeah, absolutely.
All right, and Rachel, thank you for that question. Very
Sure.
good. So folks, we've gotten to 8 o'clock and we're going to honor everyone's time tonight, but I just wanted to let you know, I put some information in the chat as far as NAMI Davidson goes, and we want to, and I think Rhonda did it before. We want to give our speakers a round of applause. So thank you very much for all that you brought to us tonight. And we will be sharing this on our NAMI Davidson YouTube channel. Usually Don has it up within about 24 to 48 hours.
The plan is it should be up tomorrow. Everyone at this meeting tonight at the session is on an email list. I'll send that out to everyone, and you all will be included on that when it goes up. It should hopefully, but keep your fingers crossed, sometime midday tomorrow.
And we'll include you, unless you prefer us not to, please let us know, but we will include you in our email list that goes out for future presentations that we do. And so we have 4 collaborative sessions we do throughout the year with Vanderbilt, and then we have some additional sessions that we do. The next one coming up for people with lived experience is from the MTA, how to ride the buses. And so that can be people that have mental health conditions, very often have anxiety around driving. And so we had just done a session on supported employment and thought, you know, it's great if we can get them employed, but how are we getting them there? And so we are doing a session on bus riding, and one of our former members, Drew Mason, is going to participate that. I know you knew that, Rhonda. Drew has not driven since he's almost 50, and he hasn't driven since he was in his 20s because of the anxiety it produced. He was a master of the bus system here in Nashville. So he is going to participate that night with us and share that with us. These are practical skills that people need to have so for their success. Thank you everyone for coming tonight. We appreciate your interest and your sharing. So have a good night, everybody.
Thank you for the opportunity.
Good night. Thank you, guys.
Thank you so much.